This series of videos was designed to provide educational content for federally qualified health centers and rural health clinics to assist with their telehealth implementation. The content is also useful for other types of providers and organizations.
Good afternoon. My name is Katy Cook, and I am the owner of 80K Health Solutions. And today I'm going to present to you developing a program model, chronic disease management models. Of course, the focus today is on telehealth, telemonitoring, remote patient monitoring, and more. The increasing prevalence, both in the United States and worldwide, of chronic diseases such as heart disease, cancer, chronic obstructive pulmonary disease or COPD, HIV, AIDS, and diabetes places enormous financial and societal burden on healthcare systems, clinicians, caregivers, and more. To address the spiraling demand on healthcare resources, the increasing need for alternative and affordable strategies to support the management of these diseases is necessary. Attention is increasingly being focused on utilizing the advances in information and communication technologies such as telehealth, and more specifically, remote patient monitoring to effectively manage chronic disease. The explosive growth of the internet, personal computers, and other digital devices, cell phones, and associated software applications has resulted in the emergence of technologies that can be used outside the clinical setting to monitor one's health status, improve clinical outcomes, and augment home care and self-management. For federally qualified health centers and rural health clinics, the disparities surrounding chronic disease prevalence and related mortality are particularly pronounced. According to the National Center for Health Statistics report from 2017, non-metropolitan or rural residents reported higher rates of multiple chronic conditions. For individuals with 2 to 3 chronic conditions, rural areas reported chronic disease prevalence rates of 22.6% compared to their urban counterparts. Rural clinics should consider developing strategies to integrate remote communication technologies into their existing workflows and patients' plan of care. Today's training video will cover 2 types of chronic disease self-management models using information and communication technologies. The first model we will review is remote patient monitoring, otherwise referred to as RPM or telemonitoring. After that, we will review self-measured blood pressure monitoring. Remote patient monitoring. Chronic diseases are often caused by lifestyle, dietary, and metabolic risk factors, sometimes hereditary as well. These can be prevented or mitigated by behavioral changes, such as smoking cessation, healthy diet, and increased physical activity. The first program model we will dive into today is remote monitoring. RPM, as we will refer to it, allows the clinician or other healthcare professionals to get a better picture of the patient's overall status from a distance. Also helps patients manage or take ownership of their own health. This technology is often used for those who are at high risk and truly extends the reach of the patient's care team. RPM technologies typically collect information about physiological characteristics and vital signs, such as weight and blood pressure. A patient who has cardiovascular disease may use a blood pressure cuff that transmits readings to a data repository. The patient's care team can review this data to track the patient's progress and, if necessary, intervene before any issues exacerbate. Common examples of RPM devices include tablets with proprietary software that help the patient easily track various biometrics, voice apps that remind patients to take insulin or medication, and digital blood pressure cuffs. It's important to remember that RPM is not just about monitoring. It also includes education, reinforcement, and monitoring patient compliance. Low health confidence and depression are major obstacles to effective self-management and positive health outcomes. Is your care team assessing the patient's mental health? These are life-limiting diseases with periods of stability and increasing but sporadic exacerbations over time that can deteriorate a patient's mental status. Patient-centered guiding principles should be factored into the decision to implement an RPM program and what patients to target. These principles include self-management and making positive healthcare decisions, behavior changes to enhance health, building confidence, clinicians also functioning as health coaches to support the patient to the highest level of self-management, health literate software and tools, and most importantly, whole person care. To effectively develop a remote patient monitoring program, there are certain action steps that should occur. So what value is your practice looking to add? How can remote monitoring support organizational goals, such as decreasing readmissions, inpatient stays, and overall emergency department usage? Identifying telehealth champions in a clinical, operations, and IT role. Identifying the care team, which should include at a minimum the patient's primary care provider, a nurse, LPN or medical assistant, someone in billing, and someone from the front office or scheduling staff. These requirements will depend on the size of the program, which is determined in the next step. Typical staffing ratios is 1 nurse for every 85 to 100 patients. Next, you want to determine the patient population. Will your practice roll out with a pilot population to start, or will they maybe target only hypertensive patients? Research and review or demo several different equipment vendors. Federally qualified health centers and rural health clinics should pay particular attention to vendors who have electronic transmission options that can overcome geographic, demographic, and connectivity barriers in rural areas. As an example, I have worked with clinics in the past that are not able to use certain vendors, as these tablets for remote patient monitoring only work on Wi-Fi or cellular or Bluetooth. And some patients live in rural areas where there is no cellular service. They cannot afford to have Wi-Fi. They don't have Bluetooth connectivity. So these are things to consider. Lastly, develop a sustainability plan. How can this support overall goals of the organization or the health center? Goals can be insurance-driven, financial, clinical. Explore partnerships with managed care organizations can be a great long-term solution. For federally qualified health centers and rural health clinics, the financial sustainability becomes a challenge, as services such as remote patient monitoring have not been historically separately billable because they're already included in an all-inclusive rate or a PPS payment. CMS has been contacted about this on multiple fronts, but there is currently no formal opportunity for FQHCs or RHCs to build a traditional model for RPM codes. An alternative option and unique model to explore could involve the virtual check-in codes, but this code was not originally intended for this purpose and is a patient-initiated check-in. Lastly, developing policies and procedures, consent forms, or a consent process if it is done verbally, checklists, and patient inclusion and exclusion criteria will be really important for a successful program. Inclusion criteria can include patients who are diagnosed or at risk for multiple chronic conditions, are high utilizers of the overall healthcare system, and they can demonstrate the ability to use the equipment, have adequate home internet, and agree to communicate frequently with their care team. Checklists help the telehealth team, whether it be the nurse or the primary care provider, to properly install and train patients on the device that is being brought to their home. Develop workflows for enrollment, installation, referrals, training, and alert escalation. Typically, RPM devices will have an alert system, or blood pressure cuffs will have an alert system that lets the care team know that a reading from the patient is out of a normal range. Who will monitor these alerts? Who will respond to them? What will the workflow look like If it's in the middle of the night or the weekend, what will the follow-up care look like? This is where the role of a point person or telehealth nurse is critical. It does take a team, but the nurse responding to the alerts needs a specific set of skills, such as highly developed critical thinking, good decision making, action oriented, and whole patient focused. And with the whole person care idea, it's a lot more than just reviewing biometric information. Consider their home situation, consider their family, if they have caregivers, how is their mental health? Lastly, develop and measure outcomes for success. Examples include patient and provider satisfaction, improved health outcomes, program budget, enhanced patient engagement, and improved patient biometric readings. Next up, we'll discuss the second program model we referenced in the beginning of this presentation, the self-measured blood pressure monitoring. This is defined as the regular measure of blood pressure by a patient who is outside the clinic setting using a personal home measurement device. This is an effective chronic disease management program supported by the CDC Division for Heart Disease and Stroke Prevention. It has proven useful in both reducing the risk of death and disability associated with hypertension, as well as improving blood pressure control, patient knowledge, and medication adherence. This home blood pressure monitoring is defined on the slide, and additional clinical support is a key component to patient success and can include one-on-one counseling, telephonic support, web-based education, and more. Developing such a program requires a few action steps for success. The Million Hearts Initiative, developed by the U.S. Department of Health and Human Services, outlines a comprehensive plan for practices who want to integrate this. Prepare your practice care team. This step involves selecting clinicians to take blood pressure readings and teach techniques to their patients. These clinicians should demonstrate proper technique in cuff selection and positioning and measurement without talking. Additional team members can include mid-levels, nurses, and pharmacists. Your practice should review state laws and regulations relating to individual scope of practice and licensing for roles in supporting this effort. Research existing clinical support models for self-measured blood pressure monitoring and determine the best type of support for your practice. Make sure to consider factors such as existing workforce, HIT capacity, especially patient portals, and your overall budget. A secure patient portal is key in the rollout of this program, as it will allow your practice to receive patient readings, request medication refills, and make follow-up appointments. From a budgetary standpoint, you will also need to invest in the devices that transmit these readings from patients to clinicians. This may be the most important step, empowering your patients. Clinicians will need to discuss with their patients the importance of effectively controlling high blood pressure and the link between measuring it and controlling it. Discussions should center around adherence strategies, including but not limited to lifestyle changes, dietary modifications, and medication. Clinicians will also need to train patients on the device itself and proper techniques such as general operation, when to measure, and how, such as your arm positioning. Find a tracking or measuring system that works best for the patient. Examples can include smartphone applications or reminders, patient portal messages, and even paper tracking. It will be critical for the practice to research what health plans they work with that will reimburse not only for the devices, but the one-on-one counseling services. Discussions with payers to provide this benefit coverage will make it sustainable for the long term. As of January 2020, there are two new codes on the Medicare physician fee schedule, CPT codes 99473 and 99474. 99473 is the code for setting up the device in the patient's home. It carries an $11.19 reimbursement, And 99474 is the code to bill for the readings and physician interpretation over those readings from a 30-day period, not to be billed or reported more than once per month per patient. It is unclear at this time if FQHCs and RHCs can bill these specific codes. As the prevalence of chronic disease continues to grow, with a corresponding increase in healthcare costs, there is an urgent need for effective, convenient, easily accessible, and scalable approaches for improving self-management of these diseases. The two models we discussed today are great starting points for developing your practice's remote patient monitoring program or initiative. The goal of all healthcare providers is to make sure their patients get the care they need and the care they want. With technology booming, remote patient monitoring is a simple and effective way to stay in touch with patients and meet them where they are at home. As a final takeaway, I have included some resources here, including several toolkits that will assist you in your journey of developing a remote patient monitoring program. I thank you for taking the time to listen to this brief video, and I wish you luck on your RPM adventures. Thank you.
This series of videos is presented to you by the National Consortium of Telehealth Resource Centers, the NCTRC. The NCTRC is funded through the U.S. Department of Health and Human Services, the Health Resources and Services Administration, and the Office for the Advancement of Telehealth. This map represents the NCTRC, which covers the whole United States and includes 12 regional TRCs and 2 national TRCs, which are the National Policy TRC and the Telehealth Technology Assessment Center. The TRCs have been in existence since the early 90s and were established to provide assistance, education, and information to organizations and individuals seeking information on providing healthcare at a distance. The NCTRC mission is to expand availability of healthcare to underserved populations through telehealth. For more information about telehealth, the NCTRC, one of the 2 national TRCs, or your regional telehealth resource center, please contact us through the NCTRC website. Thank you for joining us in reviewing this video series.